Okay, good afternoon, good morning, good evening, wherever it is you are joining us from. Welcome. This is Livinghealth TV, and I am Dr. Benga Adebayo. I'm coming to you all the way from Lagos, Nigeria, discussing today the very, very important issue that gives a lot of women fears, and that is the issue of uterine fibroids. Uterine fibroids. Before we go right into it, please, if you are joining us, wherever you're watching this live or you are joining us after now, please drop a comment in the comment box. Let us know where you are watching from. Like this video. If you have not subscribed to this channel, please go right ahead and subscribe right away. What else can you do? Please share this with someone. Let them know and let them find out the information that can help them. See, this matter of uterine fibroids is something that for years it gives a lot of women fear. It gives them a lot of trepidation, and they wonder, wow, they said I have fibroid, I have fibroid, and I hear it everywhere we go to speak. So I just thought, okay, today we're going to take a look at this matter. We're going to discuss it, and I hope at the end of this video everyone will know what uterine fibroids are, have an idea of what causes them, and know that a lot of the fear and the concern that people are having around it's totally uncalled for. It's totally uncalled for. So let's go right into it. What are uterine fibroids? Uterine fibroids, and fibroids generally, they are tumors, benign tumors. They are benign tumors. That is, they are not cancerous. They are benign tumors of the smooth muscles of the uterus. We have two types of muscles in our bodies. We have muscles that we control. For instance, as I move my hand, move my head, these are muscles that I tell them, do this. My brain says, do this. And they go right ahead and they do it. We have other types of muscles. These muscles are not under voluntary control. The brain finds a way to control them to do what they have to do, but you can't mentally, consciously control them. I think that's the word I'm looking for. You cannot consciously control them. And the uterus is full of this kind of muscles. So when these muscles now develop and grow more than they should, bound, and they become bound together tight, and start to grow bigger, then we say that person has a leiomyoma. That's a fibroid. Don't mind that big English. It's just what we call uterine fibroids. That's a scientific name. So when somebody has that outgrowing, that overgrowth of muscles in the uterus, then the person has uterine fibroids. So smooth muscle tumor of the uterus that is not cancerous. And that's the key word now. It is not a cancer. By that we mean that it cannot spread. It cannot live where it is and go somewhere else to cause that it cannot metastasize. It cannot live where it is, either directly to adjacent structures or through the blood to go to far places, the heart, the lungs, the spine. It can't go anywhere. It just stays where it is. It's a local tumor. It is benign. But even being benign, it can still cause local symptoms. It can cause symptoms in places that are around it, but not the uterus, as I will be going to discuss a little bit later. So never mind. If you have any question during the course of this program, please go right ahead into the comment section and ask the question. By the grace of God, we'll try to do justice to your questions and answer them. So why do people have uterine fibroids? What causes it? Why do people have uterine fibroids? Michael, thank you. Welcome. Why do people have uterine fibroids? We don't know. You doctors, what do you people know? You people truly, we know a lot of things, but we don't know why people have uterine fibroids. We cannot particularly say this is the reason, this is it. No. But we haven't said that. We have an idea of some things that if we see, they make you more at risk of having uterine fibroids than if you don't have those risk factors. The number one risk factor that I would like to mention first is being Black. Yeah, being of African descent. We know that if we take 10 women of African descent in a room and we scan all of them, we do an ultrasound scan of the wombs of all of them, up to 8 in 10, 80% of them will have uterine fibroids. It may be as small as as a grain of rice, yeah, but they have it. So what does that mean in essence? If you're a Black person, if you're an African, that you have uterine fibroids, it's not news. Do you understand what I'm saying? If you are a Black person, if you are a person of African descent, and somebody did a scan of your womb and they said to you, oh, we found a fibroid there, it's not something that should make you lose sleep because it is so common. 8 in 10. Can you let that sink in? 8 in 10. 8 in 10 Black women have uterine fibroids. So let this fear, this thing, oh, they said I have fibroid, oh, they have, no. So please, it may be small, and that's the condition of most people's fibroid, as I will get to when we start to talk about signs and symptoms of uterine fibroid. So it's there. 8 and 10. What are the other risk factors that we know of uterine fibroids? Hormones, estrogen. We know that people that are uterine fibroids happen in people that are in the reproductive age group that are producing estrogen, progesterone, and they are producing, estrogen, and the estrogen is there. So we know that this is a risk factor, and that's why we also see pregnancy as being protective, because what pregnancy does is to give your womb a break from continuous, at least for 9 months, hopefully, you have a break from the effects of estrogen on your uterus. Michael, I see your question, and I will get to it. Does food have to do with it? Some people say it's the food that we eat in this part of the world. For instance, yam. Could that be true? No. But we'll talk about that a little bit. Maybe they might be onto something, because yam actually has estrogen. Yeah. So, and that's why we see some people in some parts of the world, So, but I will try to get to. I'll try to get to it later, but not really, because some other people too that are Black, that are in other regions of the world, they also, while they have changed their diet, they removed yam, but they are still at greater risk. So we think it's the genes, just the same way that Blacks are more at risk of hypertension, just the same way that Blacks are more at risk of keloids. So something around collagen, around smooth muscle, we don't know yet, but it's just a theory that is out there. So the risk factors, and of course, being in the reproductive age group is a risk factor, because as soon as you attain menopause, after your menses come and the on and off effect of estrogen is taken away from your body every month, those that have uterine fibroids, those fibroids shrink in size and become more manageable. So what happens to you when you have uterine fibroids? What are the signs that your doctor can see, or what are the symptoms that you may feel that may tell you that you have uterine fibroids? The first one is what? No sign. No sign. Nothing may be wrong with you. And that's what happens to the vast majority of people. They are going up and down, doing all their kinds of their normal daily activities with uterine fibroids, and no one knows. They don't know. People don't know, and they are fine. Yeah. So depending on the location of the uterine fibroids, you may not have some other things that, some other symptoms that you may complain of. Now, so if an uterine fibroid is just under, no, different fibroids, we also classify them based on their location. We have fibroids that are outside. They just hang like a pendulum. They are attached to the womb and they are outside the womb, swinging free. That's one type of uterine fibroid. We have some uterine fibroid that stay within the muscles of the womb. They're just there in the muscles of the womb. That's another type. And we have some that are just under the inner surface of the womb. That's another type. And we have some that, like those ones that are hanging outside. We have some now that hang and deep inside the womb. That's another type. So depending on where the fibroid is located, you may have different symptoms. So some people may just come in with sudden abdominal pain, very painful pain that they've not had before. That could be an uterine fibroid that is outside the womb, that is on a stalk but has twisted on itself. So having twisted on itself, blood supply is cut off, and then the person has severe pain, vomiting, fever, and all that. What we call in medicine an acute abdomen. Yeah. And it could also even be, in fact, the more common one that a lot of people have is heavier bleeding than normal. The bleeding for days on end. They can bleed for 1 week. Normal menstrual period, yeah, okay, 3 days, 2 days to 7 days, 5 days, mostly 3 days, most people. But yours is just unending bleeding. And even when the bleeding comes, it's heavy flow. Yeah, strong pain. That may suggest that you have an uterine fibroid. For some other people, they can just start seeing that their tummy is growing big. Their abdomen is growing bigger. They are just growing bigger. That may, in addition to other masses, anything that grows, that can grow big in the abdomen, any tumor, either cancerous, non-cancerous, that can grow big, so uterine fibroid can make your tummy bigger than it should. Now, some people may say, "Oh, what of infertility? Can fibroid make somebody not to have a baby?" Not really. Not really. Because like we said, 8 in 10 people, is the incidence of infertility amongst Black people, is it 8 in 10? Certainly not. 80% of Black people are not infertile. So many people carry their babies, get pregnant, have their babies without problems, even as they have fibroids. No, so it's not. But now I told you that fibroids may be located in different places. If a fibroid is located just under the surface, the inner surface of the womb, it is possible that fibroid may affect implantation and sort affect fertility. That's possible. But fibroids in themselves do not, the presence of fibroid does not translate to infertility. That's not so. Those are some of the common symptoms that we have as far as infertility, as far as uterine fibroid is concerned, as far as uterine fibroid is concerned. So those are the symptoms. I've told you about the signs, told you about what it is. So now, what should you do? How can we manage uterine fibroids? And this is where I want to speak to our women and the men that love them. I'm happy that, in fact, it's a man that has come and asked questions. For now, I hope the women also will go ahead and ask their questions. Fibroids, the number one approach to a fibroid is what we call watchful waiting. What does that mean? You don't do anything. Like I said, many people, vast majority of people are carrying about fibroids, and those fibroids are not harming them. If it is not harming you, if it is not giving you cause for concern, you are not bleeding heavily, your tummy is not getting big, or some fibroids may not grow, but it can cause local symptoms. Because there are so many things around the womb. Your bladder is around your womb. So if somebody, so you just find that you are urinating frequently, you can't take urine all the time, you're just urinating frequently. Okay, so that's a symptomatic fibroid. Or the fibroid has so grown so big, it has now started compressing on things around, compressing on the ureters. That's the things that carry urine from the kidney. Or you have an emergency with the some fibroids grow so big, they outstrip their blood supply, and then they start to die, and that will come with severe abdominal pain. So that's a symptomatic fibroid. So, but if you have fibroid, and that fibroid is not causing symptoms, we leave it alone. We do what? We let sleeping dogs lie. There's a tragic story of a young woman that I heard. It pained me so much because I still saw her, and then she had uterine fibroids. She was told, somebody told her she had uterine fibroids. Not married, mid in her 20s, and she just felt, I don't want this thing in my body. I don't want this thing in my body. And she secretly went somewhere to have an operation done. I'll still get to that. Operations, when done by competent people, by the right people, are safe. I don't want people to have an inordinate fear of operations. Likewise, I don't want people to have a likewise inordinate likeness to say I must operate it, because there's no operation, even under the best of circumstances. Uh, Everything has a margin of risk. So if an uterine fibroid is not causing problem, it's not giving issues, we leave it alone. More so in a young person. Part of the reasons why we do that is because doing the surgery that is called a myomectomy, that's removing one uterine fibroid. You may not be able to remove all. So if you remove one, what made that one to grow, especially when you are not symptomatic, so it can make others also to grow. So we so watchful waiting. I will talk about surgery. I've already started talking about the indications for surgery, but we'll talk about it again as we go down the treatment modality. So watchful waiting, not intervening, letting sleeping dogs lie, watching periodically. You come for checkup, they take a look at you. Are you fine? What's happening? Watchful waiting. If bleeding, so we can also now have symptomatic management, particularly if somebody is close to menopause. The problems are not, because we expect after menopause, you're in your 50s, the fiber you have is just giving you, or you're in your late 40s or mid 40s, just making you bleed more frequently than you should, or making you bleed heavily. Then we can look for other treatment modalities to help you navigate those symptoms. So analgesia will be useful, giving you things to help with the bleeding. We have IUCDs, that's intrauterine contraceptive devices that have progesterone that can help. They can help with the bleeding. They won't make the fibroid to shrink, or it won't reduce the size of the fibroid, but at least it will help with the symptoms that you are feeling. So symptomatic management of the things that the pain, bleeding, you can do that. And we have some medicine also. Like when your periods are heavy, when you see that it's heavy, you can take that medicine. But of course, you discuss that with your doctor. Your doctor will prescribe that for you, and it will help with it. And we also have a drug, because we know I said that what happens with fibroid is hormones. We think the hormones that go into the body fit them, make them grow big. So there's a drug that blocks the fibroid from being responsive to those hormones. So if somebody cannot get food, it makes sense that the person may shrink. But the thing about these drugs is that we rarely just use them if we have somebody that has fibroid mass that is so big. You use them to make the fibroid mass to shrink so that it can be more amenable, it can be better, easier treated when you are doing surgery. The reason why we don't use those drugs just anyhow use them is that when you use those drugs, initially there's a reduction in the size of the tumor. But you know what happens after a while? Even as you continue using the drugs will not, the tumor will stop responding to the drug, and then we now have a rebound growth. It grows faster and bigger. So those medicines are only used, they are only used to help, usually used to just help people shrink the tumor, most often in anticipation for removal at surgery. Do we understand that? I think that's important. So those are non-medical, non-surgical interventions. We also have a more recent non-surgical intervention to handling uterine fibroids, and that's using high focus ultrasound therapy, high intensity focused ultrasound therapy. What do they do in this therapy is that they focus a, a beam of energy via ultrasound to the tumor, to the center of the tumor. So they kill the tumor. And once something dies, given time, the body will process it, take it away, and reabsorb it. And this treatment is being trialed. It's recent, newer, because this is relatively new, and it's being trialed in different centers of the world. And the results are encouraging that this may be useful for people that the symptoms are not so severe, the tumors are manageable, and so. But you discuss it with your physician and see if you are a fit for this modality of treatment. Promising you go and you are good. Get it done outpatient basis, and in a few months, the tumor has shrunk and the body has taken care of it. So, non-invasive, non-invasive modalities that don't involve surgery. Now we have other modalities that involve surgery. And this we can split into two. We have the things that we call minimally invasive surgery. So keyhole surgery. They just make a small nick in your body and then pass instrument through that small hole to take care of, of, of the tumor. That's what's the advantage of that? Less bleeding, the person gets better faster and be able to recover faster. Keyhole surgeries, some are more expensive, it takes more expertise, so of course, better care, better level of equipment, the training, and all that to get that done. But it's an option that is available for treatment. And then, of course, we now have the open surgery where open myomectomy, where each tumor, as many as can be removed, are removed one after the other, or if it's wrong, and then they are taken care of. They are sent for histology. You don't remove anything from anybody's body and throw it away. Anything you remove from somebody's body, you must always send it for laboratory histology to say, okay, this truly is this. This is this. So that's that for momentum. If you are just joining us, thank you for joining. If you have not liked the video, please like the video, drop a comment, let us know where you are joining us from, and please subscribe to this channel if you have not done so, and share this video. Share it. Let someone learn all that we're talking about. Okay, so going on. So we said myomectomy. So myomectomy, that's the open surgery that you remove each of the tumor one after the other, sew the person back, and get the person done. No, so uterine fibroid is a tumor of the uterus. I think it makes sense that if someone doesn't want to have babies anymore, or the fibroids are so big, they are causing so many problems, there's bleeding and all that, and the person chooses and says, okay, I think I can do with an hysterectomy. I want to remove my womb. and I remove the womb, it follows that the person cannot have uterine fibroids anymore. But this is, of course, somebody that still wants to have a baby. You can't say the person that let's remove your womb, or someone that is having that came to do the surgery because he wants to have a baby, and I say, okay, let's remove your womb. That's crazy. You can't do that. So hysterectomy is while it's a cure, it's a definitive cure. It's not something that everybody is willing to do. Neither is it something that is the best one for everybody. Yes, so that's fantastic. So somebody has asked another question. Thank you, doctor. Can someone that still want to conceive go through uterine fibroid embolization? Yes, that's one of the minimally invasive. Now I say keyhole surgery. So you can do that. It's one of the things that you can do. You can also even go. It's the ultrasound therapy, the high focal energy ultrasound therapy is also now available in Nigeria. You can ask around for it and try to do that. So you can't do the uterine fibroid embolization. But like I said, uterine fibroid, the presence of a fibroid is not an enemy of fertility. It's because some people, if we say subserosal, we say, okay, yes, so the fibroid that is under the inner surface, some people have those kind of fibroid and yet still have their babies. But if we have tried every other thing checks out, your hormones are checking out, the male partner is sperm levels are okay, his sperms are healthy, the woman is ovulating normally, the tubes are open, and you're now thinking, what else can be wrong? Why is this person? And then you see a fibroid and say, probably it's possible that is this fibroid that is affecting fertility. But uterine fibroids and that you have a fibroid does not mean that once there's fibroid, you cannot have a baby. No. But of course, uterine fibroid embolization will be helpful to treat. It's one of the treatment modalities. So if the fibroid is there, it's not giving you, you're not getting blood supply to it, it's going to die. And then he said, why does some doctors discourage, what is UFE, please? Can you let me know what UFE means so that I can answer you? Do you mean HUFI? So tell me what UFE means. Let me know what UFE means for you, and then I'll be able to answer that question. So what we're saying is discuss with your doctor, know what needs to be, don't be afraid of uterine fibroid. I was telling you of that, my young friend. She pastored, young woman, not married, with a fibroid that is not disturbing her, but because somebody said she actually have fibroid, she went to operate and seems she operated in the wrong place. It's highly unfortunate. Uterine fibroid embolization. I don't know why somebody would discourage that. So, because every treatment modality has a criteria that somebody must pass, somebody must meet for the person to be eligible for that treatment. So the link, I think if you check under your screen, you just see share on the video that you're doing. Under, you just see share. On your screen, you see share, click the share button. And it's the same link that you used to get into the video. You just click share, post the link, you are on your way to sharing. Thank you so much for wanting to share. I appreciate the share. So uterine fibroids in rounding up, before we go to the area level now, uterine fibroids very common. It's not a death sentence. Uterine fibroids is a benign tumor. It is not cancer. It is not cancer. So somebody can have an uterine fibroid cohabiting with an endometrial cancer. So that's a different thing altogether. But uterine fibroid in themselves, almost never becomes cancerous, because we say never say never in medicine. It's one of the things you are taught in med school. I think there are just two things that we say never, and never is never. But I won't bother to tell us about those things. But almost every other thing we say never say never. Uterine cancers are uterine fibroids, pardon me, are benign tumors that don't cause cancer. They are manageable through non-invasive methods, and you may have to do some invasive methods, including some of the things that were mentioned today, and that's it. So no fears, no fears. Okay, so everybody we want to join now, we don't wait for area level. Thank you. Say you join us today. Now, area doctor day, and we talk about Livinghealth TV. We discuss the matter of uterine fibroid. We don't tell you say fibroid that it's when tumor grow inside person woman womb. Now only woman they get womb now. So I don't know if you get fibroid, it's not going to be uterine now. That's why we like to be specific and say uterine fibroid. If you get fibroid of any other tumor, once it be smooth muscle, it also if you say I won't become big now. So now uterine fibroid there is very common, especially for black people. If you say 8 in 10 black people can get fibroid. Before we continue for area, this one an important question. You say, what are the chances of fibroid coming back after a successful surgery? Very high. So like we said, so it's not very high, but it's possible. That's what I'm just saying, that because the same conditions that made that fibroid, that smooth muscle cell to grow big, can make another smooth muscle cell to also grow big. And while you do uterine fibroid surgery, you may not, there may be small, maybe as small as a grain of sand. You won't remove that. You may not remove all. So you remove the big ones. There may be some that you did not remove. And after the surgery, given enough time, those ones too can grow back. So yes, fibroid will grow back after a successful myomectomy. But if not hysterectomy, when they don't remove the womb, nothing will grow again now, because the thing when they grow, they don't come out. So we say fibroid, they get no be thing wey person supposed to fear about. I get fibroid, no mean say you know if you have baby. If you get your children, if you born pikin, if you born triplet, born 4, born 5, even with fibroid, the baby go dey there, they do it own, the fibroid go dey there. But we also know, say inside pregnancy, fibroid, blood fit too, because when it's inside the womb, at that time, body blood will flow. So some people, then they undergo something wey we call degeneration. I'm not going to waste your time, tell you about that. So inside pregnancy, fibroid fit grow big and then can't die and can't give the person pain. That's one of the complications of fibroid. We know they try to make a doctor, so I just they try. So may I just say the small things where you go know, will go help you. Say no fear, no shakings about fibroid, because the main treatment that's fibroid boku everybody get on. The main thing where people supposed to know be say, if you get time, talk with your doctor, work out with your doctor, discuss with your doctor, make you know what thing you do. If the fibroid no dey disturb you, the thing when your doctor go tell you, say, I may you leave her, may they wash her. No thing they say for our side now. You say less sleeping dogs, make them do waiting. Less sleeping dogs lie you. A dog no dey disturb you. I remember one video where I see one man, some dogs that be like say they dey beside cage. The man just go beat them. Got they do as if he go beat them. Got they do as if they beat them. You know, one of those dogs can't do it. They just, you don't know, say they don't train those dogs how to open door. And so that dog just use his hand, pam, open the door. You know now, that man don't enter trouble with that. We let sleeping dogs lie. We don't, if fibroid no they cause problem, they cause symptoms, or the person just leave out. But if you now they cause symptoms, different treatment modalities, medicine, there. That medicine, there's no medicine. Area people may not listen to me. There's no medicine when person go give you, may go make your fibroid melt. We're going to make your fibroid melt. Nothing like that. Nothing like that. There's no medicine. If that medicine there, the person will get them, we don't become rich now. They're going to give them Nobel Prize. So nothing like that. So we leave it, treat it, watchful waiting. If you want to, surgical means, non-surgical means, some of them they there. But all the things I want to say, we say, know the right things what you're supposed to know about this matter. No shakings now. No fear for area. So why is it that some doctors don't know how to do surgery? Is that so? But because of this post-surgery experience like loss of tube, Asherman, and addition, how can all those be prevented? I'm not sure a doctor that doesn't know how to do a surgery will go ahead and do it, because that's why medicine is. Medicine is regulated. It's a regulated profession. We don't. If you feel a physician has done what he should not do, there are legal. There are ways to seek redress. You can go to medical and dental council, because no doctor will just do something that we shouldn't. I hope that doesn't happen. I really hope that is not happening. However, there is no surgery that cannot have complications. There's no medical procedure. We even have to go to surgery. There's no medical procedure that cannot have complications. And the right thing to do is to explain to you, for every procedure, you'll be told of possible complications that can happen. With any surgery, additions can happen. Additions is when the intestines, because we are going to where we should not go to. We are touching things. The abdomen was not made, but there are best practices. There are things that we can do to minimize additions. But even after surgery, even after the best of care by the most talented experience of surgeons, additions can still occur. Loss of tube, that's unfortunate, but it can happen. And because a doctor is also a human being, he can make a mistake. But those mistakes needed to do their practices, their best protocols in place is prevent those mistakes, which is why we don't rush into surgery. If we can do watchful waiting, if we can try other modalities that we don't have to do surgery. We don't say, there's fibroid, you are 32-year-old person, nothing is doing, it's there. I saw you one fibroid, is there, let's remove it. Because that fibroid is not without risk. So you weigh the risk and the benefits, and discussing with the patient, discussing with the person to know this is the benefit you stand to gain from me removing this one tumor. If I remove it today, doesn't mean that another one cannot grow again in 3-4 years' time. It doesn't mean that I've removed one, doesn't mean another cannot grow. So you weigh the risk and the benefit, but surgery is safe. For someone that has acute abdomen, the tumor is so big, it's impinging on kidneys. The benefit of removing such a tumor outweighs the risk. So it's a risk-benefit arrangement. You discuss it with your physician, and but there's no surgery without. There's no medical procedure. Let's even not talk about surgery. No medical procedure that doesn't have possible complications. All right. Do we have any other question? If we have more questions, we'll be happy to take them. And if you are not subscribed to our channel, please, I want to ask that you please do so. Like this video. The more we like, the more we engage with the video, the more other people see it, and the more we can achieve our goal of being a blessing to others. So a big thank you to everyone that has joined in today. Today, our live stream is coming to an end. Look forward to having you again next week, Friday, as we take on another interesting topic here on Livinghealth TV. Until that time, I'm Dr. Benga Adebayo. People sometimes call me Area Doctor because I host the program Area Doctor. Go through our channel. We have many educational and interesting videos that we think may be of benefit to you. As Area Doctor, they say, until we come again next time, make you remember, say, life, get duplicate. God bless you.